Hi, I'm Belinda O'Sullivan. I'm an academic from Monash University in Victoria and the University of Queensland. And today I'm talking to you about a paper we've published in Rural and Remote Health, which is an evaluation of a rural generalist internship program for junior doctors. The program that this paper covers has been in place since 2012, and it has placed interns, first-year medical graduates, in general practice in rural areas, MMM 4 to 7, which in terms is communities less than 15,000 people, for a period of 20 weeks. And they're supervised there by rural generalist doctors, and they visit the hospitals whilst they're placed in general practice. And this is a different program to most internship programs because the general internships are done generally in hospitals, and so going out to general practice for 20 weeks is a novel design with the intention to give those doctors the experience and exposure to what it's like to work as a rural generalist at that early stage of their career. The research team for this paper was a mix of training and health service staff and myself as a rural academic. And the study came about when the local health department wanted to understand what parts of its rural generalist training program were working well so they could understand where to invest and continue to invest. The study was done by doing a survey of all those junior doctors who had completed or were currently enrolled in that internship program, the rural internship program. And the survey was done in 2021. And it had a good response rate, around 27%. And the results were really interesting, showed that a higher proportion than average of these doctors who'd done this program were of rural origin, and really positively, all were satisfied or really satisfied with this training. And the key result that I really like to draw attention to is 61% of these graduates at the time, of those who were up to their stage of specialist training, 61% were working in general practice. That's an amazing statistic. Over 40% were also working in the same rural region currently as they had done this internship. So they were remaining in the location where they did this rural internship. And on top of that, 56% continued to complete some pre-vocational training in that same region, and 42% identified as working as a rural generalist. When we looked at the metrics, so the markers of rural generalist practice with this group, a really positive sign was also that 97% of this group met at least one of the key indicators of working at extended scope. That's really positive because we want to produce more doctors who are not just trained in rural areas, but able to work across a range of areas to meet the community need. So in conclusion, compared with industry benchmarks, the RG internship program that we evaluated attracted rurally intentioned and really experienced doctors who are likely to remain studying and specialising in the same rural region as they did this internship, and they're really satisfied with it, and they had a high propensity to follow a GP career and work at broad scope in smaller rural communities. This is so important. It suggests rural internship programs where the doctors get to get out to general practice and work under the supervision of rural generalist doctors are a really positive intervention for promoting a rural generalist workforce and a medical workforce that works at a broader scope of practice. So in conclusion, it's not an expensive intervention, but it's really important for our health departments around the world to think about giving doctors in their first year after they graduate, during their internship, giving them exposure to rural generalist rotations in general practice where they get to work with rural generalist doctors, and of course trying to select people with rural background and rural intention, enable their community connections. We're more likely to get better capacity of a workforce willing to work at broader scope and remain serving our beautiful rural communities.